Virginia. Mr. Griffith, 5 minutes for questions.
Thank you, Mr. Chairman. Thank you, Madam Secretary, for being here. In an address to the Democratic National Committee in September 2012, you stated, first, if you already have insurance you like, you can keep it. Madam Secretary, I hear from constituents every week lamenting the fact that they have lost or at risk of losing their employer health insurance plan that they like because of Obamacare. And here's the dilemma that many business folks are being put into. A constituent of mine called me, sat down with his accountants and his experts and his medical people, and what they said to him was, you have three choices. The business that you've owned for 33 years, that you started out with small and started growing and growing, you have 59 employees. So here are your choices. You pay the $43,000 fine. You close down the third shift that's the least profitable of your three shifts. You just get rid of that, and then you don't have to do anything. Or you pay even more than the $43,000 to insure all of your employees. Now, most of his employees are already covered, or a large number of his employees he already pays for, and he pays for them in full. And he's struggling with these dilemmas, knowing that some of his people won't be able to afford the insurance that he's already paying for if he drops it completely. And he has not made a decision. But that's the dilemma that businessmen and women across the United States are having to go through. And again, at the DNC, you said, but for us Democrats, Obamacare is a badge of honor, because no matter who you are, what stage of life you're in, this law is a good thing. And I have to ask you, can you really believe that to the 7,000 employees who are part-time employees for the Commonwealth of Virginia, who are facing a cutback in the number of hours that they have because the Commonwealth has decided, based on trying to make sure that they keep their costs in control, that they're not going to allow the part-time employees to have more than 29 hours. Do you really believe that to those people it's a badge of honor, or that Obamacare is a good thing because now their hours are going to be cut? Yes or no?
Well, sir, I don't like anybody's hours to be cut. We need
Yes,
to actually make sure that people get paid and work to take care
But
of their
you do
families.
understand
but health costs are part of that
And
overall payment.
I have to move on because I only have a limited amount of time, but the examples go on. In my district, we have a county, Wythe County, Virginia. They hire retired law enforcement folks to work court security as court security employees. Now, many of these people already have insurance. They're usually retired, or a lot of them are. They have insurance or they have Medicare. Now the county is going to have to cut back their hours because they don't want to have to pick up insurance for people who already have insurance. And so they're going to have to cut back their hours, and for many of these folks that translates into a 30% pay cut for these retirees. I don't believe that's a good thing, and I'll take your previous answer as the answer to that question as well, that you hate to see that happen, but sometimes things happen. And do you really believe that the 28-year-old male whose premiums will skyrocket next year, do you think he thinks that Obamacare is a good thing? And how about my 82, I got to keep going because my time's running out. How about my 82-year-old mother enrolled in a Medicare Advantage program, which is a highly popular program, which has been cut to pay for the ACA? Can you really believe, deep down in your heart, can you really believe that she thinks Obamacare is a good thing?
The good news, your mother is paying less now than she did. I don't know about your mother's plan, but Medicare Advantage plans are down 10%. Enrollment is up almost 20%. So your mother actually is in better shape than she was before the Affordable Care Law was passed.
Well, and she also got a lot of her stuff done. When she saw this coming down the pike, she said, anything that I know is wrong with me now, I'm getting it fixed. And how about Susan Surface, the 42-year-old single mother who was recently diagnosed with leukemia and turned away from enrollment in the high-risk pool program because the ACA established fund was depleted? I can't believe that she thinks that Obamacare is a good thing. Madam
If
Secretary,
repeal had gone forward, there would be no pre-existing
and what I would have to say,
plan whatsoever.
Madam, is that for so many of these folks who are facing uncertainty as to what's going to happen, who may not be able to pay the employers who like to pay for their long-term employees, who may not be able to afford to do that, they don't think Obamacare is a good thing. They don't see it as a badge of honor. I have to tell you, Madam Secretary, and I know we disagree on this, but from when I talk to my constituents, it appears to me that thinking that Obamacare is a good thing and is a badge of honor is just wrong thinking. And in fact, I believe it's going to make a majority of Americans losers in the health care arena. Mr. Chairman, I thank you so much for the opportunity, and I yield back.
Chair, thanks, gentlemen. Now recognize the gentlelady from Florida, Ms. Castor, 5 minutes for